The first part of this this morning's meeting will focus on addressing the needs of specific populations, a panel that will be introduced by committee member Selçuk Sira.
Thank you. My name is Selçuk Sira from New York University. We have a slightly different setup. We have 3 presenters and only 30 minutes for discussion, actually questions, not discussion, at the end. So after we are done with our presentations, we will have 30 minutes for all your questions. Keep your notes to the end. I'm going to keep it very short in terms of introductions because you all have the notes. So we are going to start with Nancy, 20 minutes, and we have a timer over there, 10 minutes and 1 minute.
So as soon as we get the slides going up here, there we go. First of all, I just want to say I'm really excited to be here. I really appreciate the invitation to be part of this conversation. And second, I want to have a little disclaimer that I was asked to come here and talk about parenting implementation, parenting programs that work for young children, parents of young children in American Indian, Alaska Native communities. And I can't do that because we don't really know. So really what I'm going to do today is talk to you a little bit about the context of early development in American Indian, Alaska Native communities, and why I think it's an important priority to pay attention to. I want to talk a little bit about the evidence gaps, the little bit of evidence that we have about what works, and really why we don't have more evidence. And I want to share with you sort of a roadmap, a plan for moving forward. How can we begin to address these gaps in the evidence? So first, in terms of the cultural context, and it's part of its culture and part of it's just context, is we do know that children are at high risk in American Indian, Alaska Native communities. I've listed here just a few of the things that we know are significant issues. And also an important point to note at the beginning is there is tremendous variability across the context in which these young children are growing up. There are more than, I lose count, but there are more than 560 federally recognized tribes in the lower 48 and in Alaska. In addition to that are state-recognized tribes. In addition to that are non-recognized tribes. So there's a lot of communities, and there's a lot of diversity across those communities, both in terms of cultural context and also in terms of the kinds of risks that children face. But these are some that are pretty consistent across communities. Health disparities are pervasive, and these range from high rates of obesity, really significant rates of oral health problems. I was talking to a colleague the other day who looks at caries in young children. She said someone challenged her at a conference and said, there's a typo in your poster because there's no way the rates are that high. She said, no, the rates are that high. And that has significant implications for health in all kinds of levels. Substance abuse can be quite high in a lot of tribal communities. Rates of suicide are astronomical in a lot of tribal communities. One of the communities we're working in now, we were there in February, and within the 2 days before we arrived, in the week we were there were 4 suicides of children between 10 and 14 years of age. This is a very small community, so it's a significant problem. Another issue is that developmental disparities in academic achievement are also significant. We have some evidence that American Indian children begin to drop below national norms between 6 and 15 months of age, very early. There's long been evidence that academic performance suffers beginning in elementary school. Graduation rates are quite low, and there are long-term implications for these kinds of issues as children become adults in the community. Another thing that's very important, I think, in tribal communities is that exposure to trauma is very common, and the effects of that are devastating. Epidemiological evidence suggests that more than 60% of the American Indian and Alaska Native population has exposure to significant trauma. And for most of those, more than 90%, that first exposure is during childhood. We've done a lot of work looking at what happens when children are exposed to trauma early on, and there are significant effects in terms of substance use, substance abuse, lifelong substance problems, risk for suicide, mental health issues like depression, anxiety, and sexual risk, early and risky sexual behavior, which in many cases there are high rates of teen pregnancy and teen parenting, and parents who aren't ready to parent by the time they begin to. So there's a lot of reasons to be attending to issues in early childhood in tribal communities. There are also a lot of reasons that parents are at risk. I'll start kind of with the bottom. I should have reversed this, I realize, but American Indian Alaska Native parents face high levels of stress. And they share these in common with parents in a lot of ethnic minority communities. Poverty rates are extremely high. Daily experiences of discrimination are extremely common. As I just mentioned, trauma exposure is high. And there are high rates of substance abuse in many communities that really impact families and the way that families operate. In addition to that, there is sort of a unique history in tribal communities around colonization policies and how disruptive those have been in the past to families and to parenting. Anyone in this room aware that American Indian children were still being forcibly removed to boarding schools as late as the 1960s? My generation, yeah. There's an impact of that. People who became parents who were raised by institutions don't know how to parent. The disruption in the cultural traditions around parenting and how do you teach your children and how do you raise your children it was really taken away from many in these communities. Child welfare policies, until the Indian Child Welfare Act in 1978, there were very high rates of children being removed from their homes and adopted out or fostered out into non-tribal communities, non-tribal families and non-tribal communities. And there, just one other example, these are just a few of the examples, but one other example was the urban Indian relocation programs back in the 50s, which promoted families moving out of tribal communities into urban areas and really disrupted the extended family networks and the cultural context of child rearing. So there is, and if you talk to people in tribal communities, there is a very common perception that we don't really know how to parent. The ways that our parents were parented, it's disruption. There's disruption in that chain. And there's a lot of conversation about we need guidance. We need to know how to get back on track and how to parent. One of the things that we hear in communities when we have these discussions, almost invariably, is we have the answers here. There's a very strong sense that if cultural structures could be reinstated and people could connect again with their cultures, that the values, the language, the identity, the kinship structures and the roles, all of that really could support better outcomes for parents and better outcomes for children. And one of the things I want to mention here is, one of the things we encounter a lot is we go into these communities and we talk about what outcomes you want for children. And we have a perspective, a certain perspective, I think, in the child development literature broadly and in the nation as a whole about what good outcomes are. That's not always what these families want for their children. A very concrete example, we've been doing work on an early developmental screener. And some of the items on that screen, it's called the Survey of Wellbeing for Young Children. Some of the items on that screener are things like the child makes eye contact, or the child is sort of gregarious around strangers. People in communities say, we teach our children not to make eye contact. That's not culturally appropriate. And we teach our children to be very quiet and reserved and respectful of elders. And so those children look bad on those markers of child development. And so it's really important in thinking about how do you help parents in these contexts, how do you help them to do what? What are their goals and how do you support them in reaching those goals for their children? So that's kind of the context in a very, very quick nutshell. I want to tell you a little bit about the evidence that we have about what's going on, what works and what's going on. And really first I just want to say there is a lot going on. There are a lot of services being provided. There's a lot of effort being made to support children and to support parents in these communities. Through my work with the Tribal Early Childhood Research Center, which is funded by the Administration for Children and Families, we work with Head Start and Early Head Start programs, maternal infant early childhood home visiting programs, child care programs, and a little bit with Project Launch, which is a SAMHSA program designed to sort of tie things together in early childhood services. Part of our goal is to sort of integrate research with what's going on in these programs and figure out how we can better inform how they're serving parents and how they're serving children. Another thing I wanted to mention, colleagues up at the Brazelton Touchpoint Center at Harvard are conducting a review of more than 130 parent and family interventions, and they've found that many of these are being used in tribal communities. So independent of that sort of federally funded big initiatives, there's a lot going on. And actually, to back up, there are more than 150 Head Start programs. There are 25 tribal home visiting grantees, more than 200 child care programs. So there's a lot going on at that level. Unfortunately, the evidence base is extremely thin. Region 11 programs, which are the American Indian, Alaska Native programs, and Head Start, have always been intentionally excluded from studies of Head Start. I'll tell you a little bit more. We're working on changing that. In the home visiting evidence of I can't remember. It's a review of home visiting programs. There was, in the original report in 2011, there were no programs that were documented to have evidence of effectiveness in tribal populations. They revised that last year with the continuing evidence from our colleagues at Johns Hopkins and the Family Spirit home visiting program. There's now one. So there's one program that has an evidence base. If you look at the evidence base for home visiting programs more broadly, there's quite a lengthy list. In the Brazelton Touchpoints review, they found no evidence base for parenting, family engagement programs in tribal communities. But you'll see they had a pretty high bar, one peer-reviewed publication, right? Even by that standard, they found no evidence. So we do not know what works and what doesn't work. And as you saw from I hope from the contextual information I provided, we have reason to think it might be different. So marching in and saying, we have an evidence base, let's use it here, is really misguided. And one thing that's especially missing is evidence about the role of culture. And communities are clear, culture matters. We just don't really have a good sense of how to document that, how to even articulate in what way does it matter, what are the mechanisms of cultural impact, and how do we measure that, and how do we figure out how to tailor programs that actually work in this population. And this is very hard to see, I realize, but I wanted to talk to you a little bit about why we don't really know. And that first header says that it's a small, diverse population. As I mentioned, there are more than 500 tribal groups. It's 1 to 1.5% of the population in the United States. So it's small, but it's huge. And so it's very difficult to determine the effectiveness of programs when you're working in very small samples. Requires very creative and often imperfect design. I would say always imperfect design. There are a lot of measurement challenges. We have very, very, very little data on the reliability and validity of standard measures for use in this population. AIANs are generally not included in standardization samples, certainly not to any level that we can determine how effective it is with them. And measure development work is very expensive. And in this very small population, it's hard to draw those kinds of resources. Sometimes we just don't even have the relevant measures for things that we know are really important, particularly around the cultural pieces. There is a resistance to research in tribal communities that follows out of a past history of research abuses that have really created problems in tribal communities, and also a very clear mismatch sometimes between indigenous ways of knowing and Western scientific ways that just become sort of a clash that's very difficult to get past. In addition, very small research workforce of tribal American Indian, Alaska Native individuals who are trained to do this research and really bridge the gap between the culture and the communities and the scientific expertise. Community resources are extremely scarce. Many American Indian, Alaska Native communities are in rural settings, or in urban settings they're very dispersed. You don't have cluster neighborhoods like you do with a lot of ethnic minority groups. So it's just very logistically difficult to do the research. Resistance to randomized control designs, which I think is probably common in a lot of communities, but tribal populations are pretty vocal about that. They don't want denial of services to anyone, especially given the very high levels of need in communities. We have this other issue of tribal sovereignty. Those 560 plus nations, those are nations. So we have not just our university levels of protections and IRB approvals, but there's a wide variety of approvals that happen at the tribal level. And it's a nation-to-nation relationship that we have to navigate and negotiate in a positive and quality way. very clear issues about even things like ownership of data. We have NIH funding, and the tribe says they own the data, and NIH says they own the data. There's a very long, protracted negotiation to figure that out. And this work is very expensive for a lot of the reasons just listed there. So I don't want to leave you completely with, well, let me get back to this. We're stuck, this is terrible, it's impossible. And this is overwhelming, so I'm not sure it's much better, but this is a roadmap that was created by a work group called together by the Children's Bureau, and it had the specific focus, and hence the title, of improving evaluation practice in tribal child welfare programs. What they did was bring together around the table a couple dozen individuals ranging from university researchers to evaluators working in communities to tribal program staff to tribal government representatives to talk about how do we do a better job of figuring out what works. And the upshot is this is not just for tribal child welfare programs, but instead really applies to evaluation practice, to intervention research, to any research in tribal communities. And I would say, with the exception of some very tribally specific pieces to this, really in any communities where you're trying to figure out what works in the community. But you'll see there are several different layers here, beginning with the historical context in which research and evaluation in tribal communities is situated, the values that we, as a collective, as this group, felt like were very important in structuring this. The stakeholders, the little white boxes around the edge, are all the different groups that need to be involved in really informing how we do this work. In the middle is this new narrative. It's sort of the vision of what it should look like. If we're really going to do a good job of understanding what works in tribal communities, it should be collaborative, it should be culturally informed and culturally responsive. It should address local questions and use local data. It should involve bidirectional learning where scientists are learning about the culture in the community and community people are learning about the research and how to be better equipped to answer their own questions about what works in their communities. And it's really hard to see in this, but there are two, sort of the blue sphere and the orange sphere. The blue sphere is really around relationship building and about the importance of having genuine conversations and building trust and making a truly collaborative enterprise. And in the orange sphere, it's a series of steps to knowledge and skill building. That really, it's not that we come in as researchers and we do this fancy science and we answer the questions and we leave, but it's really building the capacity within the communities to do that work and to have that be informed work that really gives us answers we can trust. So all in this, man, these colors don't show up. You really can't see, but there are some links here, and I'm hoping maybe the slides will be available.
Can we turn off the first set of lights? Were there?
Well, okay,
we did that before, no? Oh.
But they're click-on links is what I'm saying. If you get the slides at some point, you can click these links and follow them. And there's a great deal more information about that roadmap for effective evaluation, including a long document that goes through each of those points and talks about why they're critical, why they're important to this process. One of the things I really want to mention up at the top there is this idea of scientific and cultural rigor. We had a lot of debates about, do you sacrifice scientific rigor in order to make something fit within the community context? And if these sort of recipes we have for good science are untenable in the communities, what do we do? And really what it came down to was, if we apply those recipes in the communities, we don't get rigor. We get garbage because they don't fit. They're not attending to cultural protocols. We don't get information that we can trust and that is reliable. So really what's critical is balancing not the sort of how-to level of what do you do for scientific rigor, but the idea up here. What we're going for is trustworthy information, valid information, and how do we do that in this cultural context? By attending to cultural protocols, cultural values, cultural ideas of what child development should be like, cultural ways of supporting parenting. That's all going to be part of the picture if we're going to have trustworthy evidence. And see if I can do this in 1 minute. These are just some examples of projects going on now that are trying to take that roadmap approach. One is, as I said, tribal programs have been excluded from the national studies of Head Start. We're working now to include them in the redesign of the Family and Childhood Experiences Survey. And it's a very intensive process, community partnership with Head Start program directors from across the country, consulting weekly with Mathematica, who's the contractor on this, to really inform that design in a way that we can get information we can trust. The home visiting partnerships, the grantees for early maternal, infant, early childhood home visiting are required to do rigorous evaluations to add to the evidence base as they're implementing their programs in the community. And then the Survey of Wellbeing of Young Children is a new screener that's come out, beginning to look at its validity in tribal communities by having conversations in communities around the country about what does this measure look like? Is it useful in your community? How might it be useful? How might it need to be adapted? And sort of setting the stage for a true validation study of a tool to be used in this context. And just parting words, it's really going to take intentional scientific community partnerships in order to understand how to best support parents of young children. And I think I'm out of time. I got the red light, so. Just two things, if you get the slides, some websites and also just some references that provide additional information about what evidence we do have.
Thank you.